All right, Janet, would you like to come take a seat here for me?
Thank you.
That's okay, thank you. So, how are you this morning? You're looking a lot better than last night.
I feel much better.
Sorry. That's very good to hear. So, before we discharge you this afternoon, do you mind if I ask you a few questions about your asthma?
That's fine.
Thank you for that. So, to start off with, Janet, do you smoke or have you ever been a smoker?
No.
No, okay. Do you ever have trouble sleeping at night, ever waking up restless, breathless, short of breath, wheezing?
Well, this last week and a bit I have been struggling to breathe, and yeah, I have been waking up in the middle of the night a bit short of breath, and this has happened pretty much every night this week.
Alright, and what do you usually do when you're struggling to breathe?
Well, I usually wake up with a slight wheeze, so I try to reposition myself and put an extra pillow underneath my head, and if that doesn't work, I use my reliever.
Alright, and when you use your reliever, have you ever used a spacer?
No, what's that, sorry?
Alright, let me just get you one. So this here is a spacer. It's a very vital piece of equipment. It actually allows more medication to get to your lungs more than what your reliever does. It increases it by 40 to 60% more. So this will obviously allow more relief for you.
Yeah.
Have you ever heard of the 4 puffs, 4 breaths, 4 minutes method?
No, I always freak out and just take as many puffs and breaths as I can.
Alright, so it's actually it's proven that the 4x4x4 method is very effective, and by using this method along with the spacer, this can help symptoms, reduce the symptoms before you have to seek medical attention. Would you like me to demonstrate for you the 4x4x4 method just to help you out, see if you can do it at home, see if you can do it here?
Yeah, thank you.
Alright, I'll just get you the Ventolin. So this is what you would usually use as a reliever, is that correct?
Yes.
Alright, so we'll just take the lid off that, put it in the back here,
Yeah.
and take the cap off the mouthpiece.
Yeah.
If it wants to come off, doesn't seem to want to come off. There we go. So you do the 4 puffs, 1, 2, 3, 4.
Yep.
4 breaths,
Yeah.
2, 3, 4.
Yeah.
And then we wait 4 minutes, okay?
Okay.
Do you reckon you could demonstrate this for me?
Yeah.
Thank you. Just put that back on. Hopefully that comes off for you.
Thank you.
That's okay. So 1, 2, 3, 4. 1, 2, 3, 4. And now we wait 4 minutes.
Yeah.
That was really good. How do you feel with that method? Do you feel confident enough to be able to maybe do it at home if you ever have another attack?
Yes, thank you.
Awesome. Thank you. So I'll get the doctor to review your asthma plan and get this added on just to help you out if you ever have another attack, okay? Now, how often do you find yourself feeling short of breath and having to use your reliever per week?
Probably 4 to 6 times a week.
Wow, okay, that's quite a few times. And do you usually find yourself feeling short of breath after exercising, walking around, or?
Honestly, sometimes I can just be on the couch and I'll feel myself starting to wheeze and feel a bit short of breath.
Alright, and has this been more of a problem since you moved, or has this been an occurring a problem since, over a few years?
Well, before I moved here, I only really found myself needing to use my reliever when I was exercising, and that was not often. But since I have moved here, it has definitely gotten a lot worse.
Alright, and do you feel like you have been stressed since moving?
Yeah, I guess you could say that. I really miss home, and I sometimes feel lost living here without my family.
Did you know that stress can be a trigger for asthma? It sometimes can make you feel short of breath and cause asthma symptoms to become worse. Stress is obviously a part of daily life and it's hard to avoid. I would like to recommend some breathing exercises for you to help with the stress if you ever feel yourself feeling stressed or anxious.
Yeah.
It's pretty easy, you can do it at home. So I just want you to cross your arms.
Yeah.
And so what you do, you just close your eyes, take a deep breath in and hold for 5 seconds. And release. And you usually do that about 10 times.
Yeah.
Can I just watch you do that? I'll get you to do it 3 times just so I know that you're doing it. So ready? Breathe in. Hold for 5. And out. And in. And out. Last time in. And out. Very good. How do you feel?
Yeah, good, thank you.
That's very good. So Janet, last night when you came into hospital with your friends, they were saying that you guys were having a few drinks and had a few glasses of wine. Is that correct?
Yes, that is correct, but I don't usually ever drink, especially wine.
That's okay. However, sometimes drinking wine can actually cause asthma to flare up due to some people having sensitivity issues to the sulfates and the preservatives that is usually in most wines and most beers. Just be aware if you drink wine again, if you get any symptoms of asthma, and obviously make sure you have your reliever on hand with your spacer.
Yeah.
Always make sure to have that on you, okay?
Okay, thank you.
Especially especially if you're having 4 to 6 times a week
Yeah.
having to use it. Yeah.
Yeah, thank you. I was not aware of that. I will definitely be more cautious.
Alright. Also, Janet, when your friends come into hospital, I overheard them talking about them being repairs that need to be done to your house. Can you please elaborate on that for me?
So the roof is leaking and there is water damage on the roof. To the roof walls and some parts of the floors.
Alright. So this could be another trigger for your asthma flare-ups. There's most likely mold growing in your walls and your roof, all that stuff. Mold is usually found in damp places. It is a type of fungus that grows in damp areas, so there you go, and releases tiny particles called spores that can be harmful when breathed in. So I've communicated with a social worker. They will be able to help you, give you assistance with getting the repairs done quicker, and this can be quite essential for your health. So it's important that this can be done.
Thank you, that would be
straight away.
amazing.
That's all right. Just reviewing your history, have you ever had a preventer? Is that correct? No, you haven't had a preventer?
No, I've never had a preventer. What is that?
Okay, so a preventer is a long-acting beta agonist, which is usually taken 1 to 2 times a day. It's to help prevent asthma symptoms. A preventer is something you use for long-term effects, whereas your reliever is more used for short-term, just necessary times when you really need it, when you're feeling wheezy and short of breath.
Yeah.
Do you mind if I just call your doctor and make him aware of this information? Is that
That's
okay?
fine.
Just quickly grab my phone, sorry. Alright. Hello, good morning. This is Danielle here, just contacting you about my patient Janet Doe. She was admitted last night with respiratory distress and was diagnosed with acute exacerbation of asthma. I've just completed a health interview with Janet and collected some vital information that I would like to make you aware about. So since moving from Brisbane, Janet has had to use her reliever 4 to 6 times a week. She is living in a rental where there is water damage. She wakes up during the night with asthma symptoms, and this happens quite frequently. She has been feeling stressed also since moving. Usually her asthma is triggered by exercise, however recently Janet has been feeling symptoms without doing any kind of physical activity. Janet has presented to the emergency department on 2 other separate occasions. Just wondering if you thought that maybe administering a preventer would be a good idea for Janet? Okay, 250 microgram Flixitide, meter dose inhaler. Okay, thank you. Could you please just document that for me and maybe send through a script? Alright, thank you so much. Bye. Alright, so I just spoke to your medical officer and we both agreed that it would probably be beneficial for you to go on a preventer. So the doctor has prescribed to you, I don't have one on me, but I have a picture of one. So I'll let you look at that. So
Thank
that's
you.
what it would look like.
Yeah.
It's a preventer called Flixitide. This preventer will help control inflammatory responses and decrease inflammation in the lungs. The onset therapeutic effect can usually range from 4 to 7 days.
Yeah.
However, some people can feel it up to 24 hours, the first 24 hours. Generally people who haven't been on a preventer before, like yourself.
Yeah.
The preventer must be used twice a day as directed by your doctor, usually 1 in the morning and 1 at night.
Yeah.
It is important that you rinse your mouth out with water after using the inhaler, just to prevent thrush,
Yeah.
just because it's a corticosteroid and this usually can cause like a fungal infection. To take this inhaler, you need to take a deep breath in, so push the button just like your reliever. Take a deep breath in, inhale the medication,
Yeah.
and then just out normally. So I would recommend probably booking into your local GP in the next 6 weeks, probably I would say.
Yeah.
Just to review how you're going with this preventer, see if your symptoms have improved at all.
Yeah.
Do you have any questions for me, Janet?
What happens if I miss one of the times to take my inhaler?
That's a very good question. So if you forget to take a dose at your usual time, take it as soon as you remember. If it's nearly time for your next dose, don't double up on the dose, so just don't take it, just leave that dose and take it the next day. It's important that you don't take a double dose if the one's missed, okay? Yeah.
Okay, thank you so much for your help. I really appreciate
That's
it.
okay, thank you. It was great to meet you and I hope to not see you again in hospital, okay?
Thank you so much.
That's okay. I hope you have a good day and best of luck, alright?